Next we will move on to very important part, that is anterior-posterior diameter. So the anterior-posterior diameter, first one is suboccipitobregmatic. Suboccipitobregmatic. So the suboccipitobregmatic, this is called occiput. As you know, subocciput means below the occiput. Sub means below the occiput to the, or extends from the nape of the neck to the center of the bregma. Bregma, other name is anterior frontalis. So it is extends from the nape of the neck to the center of the bregma. It is around 9.5 centimeter. Next one is suboccipitofrontal. Same place it is starting. It is starting from the suboccipito, that is nape of the neck to the anterior end of the anterior frontalis or center of the sinciput. So this is sinciput up to here, from here to here is sinciput. It is up to here. It is around 10 centimeter. So nape of the neck to the center of the sinciput or end of the anterior frontalis. Anterior frontalis is this. This is the end of the anterior frontalis. So from here to subocciput is called suboccipitofrontal and it is 10 centimeter. Next one is occipitofrontal. So occipitofrontal extends from the occipital eminence. So this is this particular part, that is outward bone part, is called occipital eminence. So occipitofrontal is extends from the occipital eminence to the root of the nose or glabella. So this is called root of the nose. This particular area we can call it as root of the nose or glabella. So occipitofrontal, it is 11.5 centimeter. So up to here, as I told, it is 10 centimeter. So again it is extending up to glabella, means it is again 11.5. Little more length is increased. So occiput eminence to the center of the, or it is over the root of the nose or glabella, it is 11.5 centimeter. That is occipitofrontal. Next one is mendovertical. So which is mendum. So this is called mendum. Mendovertical. So mendovertical is nothing but it extends from the midpoint of the chin. So this is chin. Midpoint of the chin to the highest point on the sagittal suture. It is 14 centimeters. So highest point is the sagittal suture. So when we are holding the fetal skull like this, it is from the midpoint of the mendum to the highest point on the sagittal suture up to here. This longest diameter, that is around 14 centimeter or 13.5. Some textbooks I am referring DC Datta textbook. So it is 14 centimeter. Next one is submendovertical. Submendo. Submendo means below the mendum. Submendo, mendum below the mendum. So submendovertical. It extends from the junction of, this is the junction. So junction of the floor of the mouth and neck to the highest point of the sagittal suture. Same like mendovertical only, but it is starting not from the midpoint of the chin. It is starting just below that, and same like it is ending over the highest point of the sagittal suture from here to here. So it is 11.5 centimeter. Next one is submendobregmatic. By name itself we can understand. So from here, that is extends from the junction of floor of the mouth and neck to the bregma, center of the anterior frontalis bregma, from here to here. So it is 9.5 centimeter. So anterior posterior diameter, hope you understood. Occipitobregmatic 9.5 centimeter. Suboccipitofrontal 10 centimeter. Occipitofrontal, that is 11.5 centimeter. Then mendovertical, that is 14 centimeter. Submendovertical, that is 11.5 centimeter. Then submendobregmatic, that is 9.5 centimeter. Next one is transverse diameter. Transverse diameter is very easy to understand. So transverse diameter, biparietal diameter 9.5 centimeter. Biparietal, between two parietal eminences. As you know that this is the parietal bone. So there is parietal eminence. See from here one bony projection. This side also see. This is from these two from here to here. Both side biparietal diameter, that is 9.5 centimeter. Then super subparietal, that is 8.5 centimeter. Super sub means one side above the parietal eminence, other side just below the parietal eminence. From here, below the parietal eminence to the here above the parietal eminence, or here above means here below. One side above and one side below of these two parietal eminence. That is 8.5 centimeter. Then bitemporal diameter. Bitemporal diameter 8 centimeter. It is the distance between the anterior inferior end of the coronal suture. So this is the coronal suture. So it is the anterior inferior end of this coronal suture is 8 centimeter. Anterior inferior end of the coronal suture, that is 8 centimeter. Next one is bimastoid diameter 7.5 centimeter. It is the distance between the tips of the mastoid process from here to here. Tips of the two mastoid process, we can call it as bimastoid diameter. So this is regarding the transverse diameter. So we had seen transverse diameter, that is biparietal 9.5 between two parietal eminences. Super subparietal 8.5 extends from one point above the parietal eminence to opposite to below the parietal eminence. Then bitemporal 8 centimeter distance between the anterior and inferior end of the coronal suture. Then bimastoid between the tips of the mastoid process, that is 7.5 centimeter. Hope you understood the fetal skull. Thank you.